But yeah, so that's essentially what we do at Real-Time Ultrasound. We try and match the right ultrasound machine with the health professional, and then just support them along the way.
What would you say about sort of high end versus low end, or not low end, but handheld? What you know, how would you describe your range, I guess?
It's a good question. And Vinno Ultrasound has the whole range. So they're a premium ultrasound company. So they do everything from, you know, the radiology units right down to the handheld. And I think what it really comes down to is matching the right ultrasound machine with the right user. So everyone has, you know, they're going to use it as a tool for their own, you know, personal needs. So I think there's no point in getting a handheld if you're going to be using it on every patient, you know, all day, every day, and you want a nice big screen. And at the same time, there's no point spending, you know, $100,000 on a big fancy ultrasound machine if you're just getting into it and you kind of just want to learn and you're not 100% sure yet. So I think it depends on, you know, where the user's at, and, you know, just having that conversation about what they're going to be using it for, how their practice is set up, what type of stuff they like to do, and just figuring out which machine is the right one. So I don't think there's one machine that you just have to say, this is the only machine you can get. It's a lot more individualized than that.
And we know you were a physio by trade, and you've transitioned across to distributing devices, and I'm sure many other things as well. Can you tell us a little bit more about the company, the background, how long it's been around for, just so we can get a bit of a flavor?
Yeah, so the company that I distribute for, Vinno, has been around for more than a decade. So they're a very big company. They make great machines. Our company in Australia, Real-Time Ultrasound Machines, we distribute machines that, you know, our philosophy is really simple. We do want to match the, you know, the health professional with the right ultrasound machine for them. And then we also want to make sure that we support them, you know, with whatever they need on their ultrasound journey, whether they're just starting out in ultrasound and we need to kind of help them to find good courses and good educators, or, you know, help them set up the right presets for their machine, and, you know, give them ongoing support with their software and, you know, upgrading needs and all that type of stuff. But yeah, so that's essentially what we do at Real-Time Ultrasound. We try and match the right ultrasound machine with the health professional, and then just support them along the way.
I do not completely agree with Stuart. And as we have 3 male in here, if you ask a male what kind of car he wants to drive, you know, So I would like to have the best high defend. I like that. Yeah, that's what I want.
The only reason I disagree with that is, and I agree, if somebody said to me, you know, money is not an issue, what machine should I get? I would say get the best one. But I think the trade-off is that some people will choose nothing. If they can't get, you know, if they can't, for example, have the best machine, then they're not going to have a machine. And I think instead, if all you can get is the handheld machine, you know, we have an amazing handheld machine, and you can, I think you've seen some of the images on it now, and I think the presets, you know, where they need to be. So it's good enough, but you're right. If you can get the best machine, get the best machine, 100%. And it makes your job easier.
But a cheap second-hand car also drives, right? So in my practice, I have a very high-end, very good device, but I also have the portable ones. And if we give courses, we teach people actually on the high-end devices, because then they know what they need to see. And we also have the portable ones. And if I use the portable ones, I'm disappointed for 10 minutes and then I'm fine. Because they do work.
They do work. But yeah, look, you're 100% right. And I think it's actually easier to learn on a better machine because the picture is clearer and that type of stuff. So it is a challenge. So, you know, it's a very important part of my job, is to make sure that I get it right in terms of recommending a machine. Because if somebody needs a lot of help and they want to see the clearest and they are committed to doing it, then yeah, it makes sense to get a better machine. And yeah, that's a conversation we have every day.
Yeah. Now, Stuart, you and I were talking, I don't know, last week, and we estimated there's probably less than 30 people in Australia who might have an ultrasound either in their clinic or using it regularly. So it's still very, very small. Well, what's your view on, you know, the demand and the learning curve in the next 5 years? How many people do you reckon will be having it in 5 years' time?
Look, in 5 years, I do think there's going to just be, I do think it is moving more towards a standard of care than just, in the last 2 years, it's been a real curiosity. Had a lot of conversation. People were really kind of curious about the technology in Australia this is, but no one was really starting to use it yet. In the last probably 2 months, that's probably where a lot of these 30 people have come from. Honestly, in the last 2 months or so, people are starting to get machines. There's now courses that people can go on. They can come out and they can learn how to use it, and a really important piece of the puzzle that was maybe missing. And yeah, in the next 5 years, I do think it's going to become more or less the standard. In the same way it is for an anaesthetist who, they wouldn't think of doing a procedure without the ultrasound. I do think that it's going to come into aesthetics in the same way. Same for sports medicine, same for obstetrics. They all started off with ultrasound. They all use it in different ways.
Thanks so much for watching the video. If you want to listen to the whole podcast, go to your favorite podcast app and search for Inside Aesthetics.
If you like the videos we're putting out, please consider subscribing to our channel. Give us a like, smash the bell icon so that you get notified when we put out more content.
If you'd like to support us, our Patreon link is down below, and you can also follow us on Instagram on our personal accounts.